Hello and welcome to County Courier. I'm Gail Whitaker. The purpose of this program is to provide York County residents with information about events, items of special interest, and the general operations of the York County government. The topic of today's County Courier is the EMS Transport Cost Recovery Program. Joining me in the studio are County Administrator James McReynolds and Fire Chief Steve Kopczynski. Chief Kopczynski, what is the EMS Cost Recovery Program?
It's a good question, Gail. Emergency Medical Services Transport Cost Recovery, which is sometimes referred to as EMS transport fees, is the process of obtaining financial reimbursement for the cost of providing medically necessary ambulance transportation. Medicare, Medicaid, and just about all private insurance carriers allow for reimbursement for this service. A resident or a visitor of York County will have their insurance company or Medicare or Medicaid bill for the actual transportation by the ambulance. Our EMS Transport Cost Recovery Program is designed using compassionate billing practices to ensure that no one suffers financial hardship as a result of this service.
Mr. McReynolds, why is the county implementing this program?
Well, Gail, first of all, as the Chief's indicated, these costs are already being paid for by the citizens, and many of the citizens in one form or another, in the form of insurance premiums through Medicaid, Medicare. These costs are available for reimbursement, so the citizens indeed are already paying for them. So it's only right that we try to recoup those costs and keep from having them paid for twice. So, and we're also trying to rely less and less on the real estate taxes, and this is an alternate revenue source that once again is already being paid for by many of the citizens. So once again, we're just trying to recoup the cost that are already being paid for in one form or another.
Is this program unique to York County, or are other localities also doing this?
No, it's not unique to York County. As a matter of fact, we're the last jurisdiction on the peninsula to implement a medical transport fee, cost recovery program.
How much revenue does the county anticipate this will generate?
Once it's in place for a full year, we expect to get approximately $1.2 million.
Chief Kopczynski, will our residents and visitors see any kind of change in the service provided by EMS?
Gail, York County residents and visitors will absolutely not see any change in the services provided by our agency and our emergency responders. The Transport Cost Recovery Program will not impact the access to the excellent emergency medical services that have been provided by our emergency responders for many years. And an individual's ability to pay will never be a consideration by our personnel and during the provision of services, whether it's the care, treatment, or the transportation. And the system of providing emergency medical services within York County will remain as it always has been, being certainly caring, professional, and compassionate. And no one will ever suffer financial hardship as a result of being transported as part of this program. And most importantly, no one will ever be denied emergency medical services because of the lack of insurance or their ability to pay.
Mr. McReynolds, how will the program work? We're talking about insurance. Will citizens have to pay a copay?
No, they will not. We will not be asking for any copay, and as the Chief has indicated, we will not be aggressively trying to collect those fees. We will have to go through a collection effort, but if you can't pay, then we will not be pursuing through collection agencies and such.
Chief Kopczynski, when do you expect the program to be implemented?
Gail, we anticipate implementing the program as soon as all of the critical components are in place, which will be between now and very early 2010.
Thank you for joining me in the studio today and giving us this very important information. Please stay tuned to County Courier. We're going to take a short break, and then I will be joined by EMS Battalion Chief Tom Schwallenberg. Stay tuned for more County Courier.
Oh, jackpot.
Hello, I'm Sheriff Danny Diggs. What you have just seen is occurring all too often in our community. Your sheriff's office is on patrol 24/7, but we can't be everywhere all the time. That's why we need your help to reduce this very preventable crime from occurring. Thefts from motor vehicles have spiked dramatically in our area and constitute the #1 reported crime. In almost every one of these incidents, thieves are checking cars for unlocked doors. Once they find an unlocked vehicle, they rummage through looking for valuables.
Oh, sweet, a gun.
Simply locking your vehicle doors at all times will remove this opportunity, as most thieves do not want to break glass and attract attention. Removing valuables from view will also help remove the temptation to steal. While York County remains a safe place to live and work, we should all take basic precautions to help eliminate or reduce the opportunity for crime to occur. Please feel free to contact the Sheriff's Office Crime Prevention Unit with any questions on additional ways you can help prevent crime in your community.
Welcome back to County Courier. Our topic today is the EMS Transport Cost Recovery Program. Joining me now is EMS Battalion Chief Tom Schwallenberg. Tom, thank you for joining me.
Thank you.
My first question for you is if you would please briefly explain an EMS call and how the Transport Cost Recovery Program will fit into the process.
Citizens who call 911 are used to a rapid and efficient response by our crews in their times of need, and that will not change. The cost recovery program will not affect that. Crews will still respond when requested. We'll provide care. We'll provide safe transport to the hospital. We'll transfer our care over to the hospital staff, and only then will we seek out the insurance information that we need to do the cost recovery, if it's appropriate to do so at that time. It will not change the way we respond. It will not change the care that's given, regardless of ability to pay or whether the person has insurance or not. Our primary responsibility is to take care of their needs.
What are the charges associated with emergency medical transport services?
Okay. The fee schedule is based on a federal standard, and the charges are consistent with those of our neighboring localities. It's a tiered system based on the care provided during the transport and a mileage for transport mile to the receiving facility. The first charge is a basic life support charge, and that charge is essentially for basic patient assessment, basic wound management, fracture management and stabilization, the assessment of vital signs. And that's kind of a basic level of service, and that's at $375. The next level is, next two levels are advanced life support levels. The first is advanced life support level 1 at $475, and that fee basically covers basic cardiac monitoring, some airway procedures, some limited medications, but it's at a more advanced level than is available on a basic level. The third advanced level is called Advanced Life Support 2. That charge is $575, and that charge covers things such as cardiac defibrillation, cardiac pacing, the establishment of intraosseous needles or needle thoracentesis, more advanced, highly technical critical care skills. And then the last piece of that is there's a charge per mileage of transport, which would be from the location where the patient is picked up to the receiving facility or the other destination, and that's at $8.25 per mile.
Will anyone need to pay for services if they're not transported?
No. This program is a transport fee recovery program, and we can only collect fees on the transport. So it's really important that people understand that at no time, if they call 911 and it's deemed that the patient doesn't need to be transported, at no time will they incur a fee for that. The fee is only for the actual transport itself.
Is there a concern that citizens or visitors in need of medical assistance will hesitate to call 911?
Sure, that's a very good question. Of course, there's always a concern when you start a program like this. but the national statistics don't show that people don't call as a result of that. What's important that people understand is that, again, our primary concern is always their safety and their well-being, and that if they have an emergency, we want them to call, not to hesitate, to call 911, allow us to come out and assess the situation and take care of the problem. We don't want people not to call us because of this, fee recovery.
In the first part of the program, Chief Kopczynski mentioned compassionate billing. Can you tell us a little bit more about what that is, and what will happen, for example, if a patient's insurance doesn't cover the bill?
Okay. The compassionate billing policy basically states that we will bill the insurance company for the services rendered, and we will take what the insurance basically provides back to us. If they are a county resident, then we won't seek to bill them beyond what the insurance company is willing to pay. If the insurance company finds that the transport was not medically, there was not medical necessity for the transport, then basically we will deem that as uncollectible. For non-county residents, again, we will bill their insurance company. They will receive a bill for what the insurance company would not cover at that point.
And what about those people who do not have insurance or cannot afford to pay?
Okay. Patients who do not have insurance, at that point, if they qualify, they would be able to request a waiver for those fees as a result of the transport.
This is obviously a new program to the county and as such to your staff. Will there be a training program for the personnel in the department?
Yes, there will. We will conduct specialized training for our personnel on basically the Health Insurance Portability and Privacy Act, or HIPAA is more commonly known. We in York County have always taken patient privacy very seriously, have always done our part to ensure that their health records are secure, but there are some legal requirements with HIPAA, and we want to make sure that all of our folks are understand those requirements and that we're abiding by those requirements. We'll also do some additional training to make sure that our folks are documenting the medical necessity of the transports to ensure that the insurance company will pick up these charges.
Who does someone call if they have additional questions about the EMS Transport Cost Recovery Program, or if they want someone to speak at their homeowners association or civic organization?
Okay. If people have questions about the program, they can always call York County Fire and Life Safety Fire Administration at 890-3600, or they can contact us via the web at flsafety@yorkcounty.gov.
Thank you, Chief Schwellenberg, for joining me and giving us this very important information about the Transport Cost Recovery Program. And I'd like to again thank County Administrator James McReynolds and Fire Chief Steve Kopczynski for joining me at the first half of this program. And I'd like to thank you for watching County Courier. And remember, in an emergency, never hesitate to call 911. Thanks for watching.